A former Minnesota congressman is on a nationwide campaign for mental health and addiction care.
It's an issue that former 3rd District Congressman Jim Ramstad has pushed for more than a decade. Ramstad helped pass legislation that was signed by President George W. Bush. And even though the law is on the books, Ramstad says the work is far from finished.
And I'm living proof that treatment works and recovery is possible.
Nearly 4 years ago, then 3rd District Congressman Jim Ramstad appealed to Congress to approve a mental health parity law. It would require insurance companies to cover mental health and addiction as they do physical health care. He's still working on it.
We had the law passed in October of 2008, and we still don't have a final rule by the 3 departments that are required to sign off. And that's just unconscionable.
Ramstad and former Congressman Patrick Kennedy, both recovered substance abusers, are holding hearings across the country to convince the Obama administration to fully enact the law.
If you spread the word, we'll make tonight a really effective meeting because it'll be the beginning of how we ultimately implement the mental health parity.
The hearing in St. Paul had all the flavor of a rally, and mental health advocates say there's a good reason for that.
The recovery community is a constituency of consequence. We are a constituency that matters. We have a voice. There are policies out there that affect us as members of the recovery community.
Ramstad hopes the hearings will mobilize people to write Congress and get the Obama administration to finalize the rules. In calling for equal coverage, Ramstad says it includes outlawing higher deductibles for people with mental illness or addiction, along with prohibiting higher copayments and limiting treatment stays. Until it's fully implemented, he says hundreds of thousands of Americans in health plans are being denied their rights.
Unfortunately and tragically, many insurance companies have put plans in place that circumvent the parity law and interim regulations, thereby restricting patients' access to life-saving care.
So why is it taking so long? Health insurance companies say the law itself is vague, and even Ramstad admits it could be better. Even though he's been out of office for 4 years, he'll keep on it.
This is more than just another public policy issue with me. To me, it's a matter of life or death.
There are interim rules in place, but mental health advocates say they're too vague. Other hearings are planned for Chicago in August and New York City later in September.